Welcome to Pawpaw TV. Today we present an original program, One-on-One with Jerry McLaughlin. He discusses his life's work with Richard Lund. Today's program is brought to you by Gogies.com. Gogies.com. Your eyes will love you. This material is for educational purposes only. If you are sick, see a doctor. Maybe you can find one that speaks herbal medicine. And now, One-on-One with Jerry McLaughlin.
Now, for people who are going to take pawpaw, are there any contraindications as far as other things that they might want to take?
If I look at the mechanism, certainly CoQ10, coenzyme Q10 or ubiquinone, in both mechanisms is a cofactor, and so I wouldn't want to overdose, too much CoQ10. I'd probably just say leave that out of it. You can make your own CoQ10 anyhow.
Oh, right, yeah. It's already in the body already.
Yeah. It's just that when you get older, you don't seem to make enough, especially for the heart, and it seems it does protect the heart. So, but you might as well forget that and leave that out. And lots of folks are on high doses of antioxidants. But it's my belief that at the end of the electron transport chain, there's hydrogen peroxide that's produced, because there aren't enough protons coming down that chain. Instead of making water, it's making hydrogen peroxide. And that, in turn, causes programmed cell death, or apoptosis in the cancer cell. If you give an antioxidant like a high dose of vitamin C, it's going to quench that hydrogen peroxide and prevent the cell from dying. So the vitamin C is going to protect the cancer cell instead of causing it to die, at least at a certain concentration. Now,
that's correct.
I know that there are some physicians that are giving IV pushes of vitamin C in doses as much as 50 grams per week or so.
It's a lot.
It's a lot.
Yeah.
Now, in that case, some folks say, well, it acts as an oxidant then instead of an antioxidant. So it may be, I don't understand all of these things, but certainly I would say high doses of antioxidants I would leave out, and the CoQ10. And to take with it, I would say, well, take some immunostimulants, the polysaccharide products, like the mushroom products, the shiitake, maitake, cordyceps product. There's a beta-glucan or aminoglactan.
That's what Mechanoderma.
These are oral things that you could take. They're not going to interfere with the mechanism of pawpaw. They're going to stimulate your immune system to go ahead and work it. So that's the nice thing about pawpaw, is it's not depressing the bone marrow. So it's not going to be destroying your T cells or destroying your lymphocytes or your leukocytes, or the cells that are there to protect the body. That's the problem with, the anti-cancer chemo compounds go in there and zap all rapidly dividing cells, including the bone marrow, and that destroys the cells that are there to keep you from getting cancer or preventing the spread of the cancer.
So we've been talking about things that you don't want to take with pawpaw. Of course, we don't mean to say that if you take these things, you'll get sick from them.
Right.
Because that won't happen, but it would just make the pawpaw less effective. And I've noticed that there's some prohibition about thyroid support.
Right.
What does that mean?
Most people are balanced on their thyroid. If they take exogenous thyroid like Synthroid or, say, Armour's desiccated thyroid, then they're usually balanced. That's fine. Don't stop taking thyroid. But there are certain things like dulse and kelp products that are high in iodine. There's a product called 7-Keto that's a weight loss product that stimulate the T3 levels. And those products, see, the T3 and the T4 from thyroid go to complex 1 and stimulate it. And that's the point where pawpaw is inhibiting. So they're going to fight each other as far as their effects are concerned. So certainly thyroid is contraindicated there.
Okay.
Right.
So we've got a few things that could help, stimulating the immune system.
Right.
And then some things we should avoid, which are thyroid stimulators.
Right.
But the thyroid medicines people should continue to take.
That's right.
Because that won't be a problem, and it won't contradict itself, and it won't bring any harm to the person.
Another product that a lot of people are trying and taking with pawpaw is the noni product, and we've demonstrated at the University of Mississippi that the Nature Sunshine noni product is a very good immunostimulator. So I would say a couple tablespoons full of that noni juice a day certainly isn't going to hurt anything. And will help stimulate the immune system.
Good.
And we're working on the chemistry of the noni right now, as a matter of fact.
Oh, that'll be good to find
Yeah.
out. So, I know I've got correspondence with David Pascoe down at the University of Mississippi.
Right.
I think he's the man that has an assay for that, a bioassay.
He has
Monocyte macrophage assay.
he has these white blood cells, and he causes them to release their various interleukins and factors that they do when they become activated. And noni causes them to release these compounds and turns them on. So, yeah, he's been a big help to us, Dr. Pascoe.
Well, if you were going to say something to a cancer patient who was thinking about taking pawpaw, what would you tell him?
I'd say, give it a try.
Mm-hmm.
Look at the side effects. There aren't very few. I mean, we've had one person complain of itching so far, so probably there's a rare hypersensitivity to it. Nausea and vomiting. We've had more nausea than vomiting. Actually, I looked back. Just recently, I looked at the last 3 months for the adverse event reports that the company's received.
Yes.
And we're talking here we've probably sold 15,000 bottles, maybe even more, 20,000 bottles so far. And we've had 8 adverse events.
That's pretty good.
That's trivial, you know.
So,
So, and most of those were nausea, as we expected.
yeah.
So, out of our original 94 patients, there were 3 complained of nausea. So, that's the safety valve, though. If someone takes too much, they're going to throw it out.
Thank you, Dr. McLaughlin, for visiting with us today.
Thank you.
And I'd like to say thank you for watching. From pawpaw.tv, we'd like to remember that we want to have healthy plants and healthy bodies. Bye-bye.